Welcome to the Holistic Matters podcast, sponsored by Standard Process. Standard Process is a trusted brand at the forefront of high-quality, whole food-based nutritional supplements. Visit holisticmatters.com for a wide range of holistic health content, including articles, videos, continuing education, and more to keep you up to date on the latest nutrition science and herbal health trends. I'm today's host, Dr. Sarah Clarke, chiropractor, functional medicine practitioner, and Standard Process clinical educator. Thank you for joining us, and I hope you enjoyed today's episode. Welcome back, everyone. Thanks so much for being here today. Today, we're joined by chiropractor Dr. Brenda Holland. Dr. Holland has been in practice for over 20 years and is a leader in the chiropractic community. She's served on multiple chiropractic boards on the state and national level. And we're so lucky to get to speak with her today and learn from her. So thanks so much for being here today, Dr. Holland.
Thanks for having me, Sarah. I appreciate it.
Absolutely. And so I'd love to just dive right in and start with a little background about you, just so our listeners can get to know you and just learn what inspired you to get into the health field in the first place.
Yeah. Well, I'm an only child. I grew up on our family's dairy farm in southeastern Wisconsin, where I really learned what a hard day's work was. My dad taught me at a really young age how to drive a tractor and shovel manure and milk a cow. And he also taught me how to take care of the cows so that they produced the best milk with the highest milk fat content. And that was ultimately how we got paid, right? Was through the milk fat, and that designated, again, how we got paid. So making sure the cows received the proper nutrition was always really important for him. And I remember my dad telling me that if the cows ate healthy and had access to things like fresh grass and silage, which is basically fermented corn, alfalfa, they would produce this really high milk fat content. And he also said that one of the things we really need to focus on was making sure we took care of the land. If we took care of the land, it produced a really high yield and the best product. And I remember learning about crop rotation and using cover crop to enhance the soil and the soil health. And I found that as a kid that this stuff was completely fascinating to me, helping our cows be better and eat better. And I wanted to go to college, and I wanted to learn how to be an even better caretaker of the land and help the cows and help my dad. But unfortunately, my dad passed away when I was 13, and we had to sell the cows and all the machinery. And because I was way too young to obviously run the farm, and my mom just couldn't do it on her own because, again, I'm an only child. So that moment really changed the trajectory of my life and helped me recognize that things happen for a reason. And I knew as I got older that I still wanted to help someone or something. And it wasn't obviously the cows, but people were the next best thing. And so I really gravitated right away to the chiropractic profession because I like the idea of working with the whole body to achieve health. And that really resonated with my understanding of what I knew growing up on the farm, which is if you give your body the good things that it needs, it's going to give you what you need out of it. I remember being in high school and exploring, this profession. And I remember my guidance counselor telling me there's no future in the chiropractic profession. Pick a new profession, which is what I did. I was a sophomore in high school, and I didn't know any better. And so I was actually pre-optometry all through college. And I shadowed a whole bunch of optometrists. And that's what I was going to do until one of my college roommates and her boyfriend were taking a trip down to Davenport, which is where Palmer College is. And I'm like, well, I'm not busy. I got all my homework done, and it was a nice weekend. So I'm like, okay, well, I'll just go down there, kind of see what I was missing out on the chiropractic profession. And after that weekend, I knew chiropractic was for me. I knew that I had made a huge mistake in being pre-optometry. And I fell in love with chiropractic. And I applied the next week. For me, it was that pivotal moment of I knew I was in the right spot in Davenport. And that's ultimately what I did and what I went for.
A twist of fate there.
I know. Like I said, it was pretty exciting.
That's so interesting. Did your guidance counselor have any reason why she said not to go the chiropractic route? I find that so interesting.
No, he just said there's just no future in it. You're not going to do well. You're not going to earn any money. That profession's a dying profession. And I remember thinking, okay, well, I would like to earn money one day. So if it's dying, then I don't want to spend time in it. It didn't make sense to me because I did shadow a bunch of chiropractors. They were all really busy in practice. But, again, at that age, my mom had gone to college, but nobody else in our family had ever gone to college before. So I listened to the guidance counselor. And again, hopefully that no other person ever has to have that experience in high school again.
Absolutely. Well, thanks for sharing that. And I think it's so interesting how it sounds like on that trip and when you were there in Davenport, you kind of felt that feeling and ignited that passion, almost found your tribe, similar to how you felt growing up on the farm and seeing that connection between the earth and what we put into our bodies. That's such a beautiful way to connect that. So thanks for sharing that story. I think it's unique as well, which is really wonderful. So what an awesome way to get in there. And in terms of just coming out of school, what was that like graduating? I mean, it sounds like you were able to prove your guidance counselor wrong, but in terms of getting out of school, was it bumpy, kind of getting into the business side, or how did it go transitioning from the education and the academic side just into practice?
Yeah, I would say that it wasn't, it wasn't a smooth road, that's for sure. The analogy that, sometimes chiropractors can eat their young was definitely very prevalent. When I graduated, there was a fight for positions in chiropractic offices. And so I did a lot of fill-in work when I first got out of school. And I recommend that for students getting out of school because it really gave me a unique perspective of how different types of providers actually practice. Some things I agreed with, some things I learned from, good and bad. And I think that was a really, really wonderful experience, even though at the time it was not fun. Looking back on that experience, it was really good. So I did a bunch of fill-in work at various offices. And then I was able to work in an all-cash office for about 3 years. I also, again, I think that's a great experience to have because I learned that I don't want to do an all-cash office again. But I did, during that time, I did earn my Diplomate in Clinical Chiropractic Pediatrics from the ICA, which again, I was very thankful that I had that opportunity. And then after that, then I joined a chiropractic company, which is a group of chiropractors in the Metro Milwaukee area. And this was, again, a wonderful experience. And it was from the encouragement of our head doctor, Dr. Drondale, that I actually became involved with our Wisconsin Chiropractic Association, which is our state association. So that was, again, it was a great experience. One of the reasons why I love chiropractic companies so much in practicing in this larger group of offices, there was 5 originally offices, and now there's 22, is that because, again, as you mentioned it, Sarah, just briefly, that it's a tribe. It's a tribe of people, and I really am passionate about making sure that people find their tribe and finding people that they can bounce ideas off of and be collaborative with. So I think that was the beauty of joining a larger group. I mean, there's lots of wonderful things about it, but I think that was one of the things that initially drew me to that larger group of offices. And then giving me the tools and resources really to be able to be a part of the Wisconsin Chiropractic Association as well.
Absolutely. And is that something where meetings that go on every so often, or if someone is new out of school and they're looking into their state association, is there a way that you'd recommend just them to get involved that way?
Yeah, we have district meetings, we have conventions. I think conventions are a really great opportunity to meet new doctors and meet established doctors. Usually, at least for the WCA, we have an opportunity for the new grads to meet the old grads, old students, old, chiropractors, old, I include myself in that for sure, but doctors who've been in practice for a period of time. Because, again, finding your tribe, finding those group of people that you can ask questions of. There is no way that I came out of school, I didn't know the answers to everything. And having that pool of people that you can bounce ideas off of, ask questions, ask clinical questions is something that's so important. And I think that camaraderie and that ability to connect during conventions and, district meetings is so important.
Absolutely. I think that's all well said. And I think a lot of people coming out of school probably experience that as well, since you're going through with your friends and you have a cohort and you're studying together and learning together. And then all of a sudden, a lot of people may go different places and you may be isolated. And so finding that community of people to learn from and grow from, whether it's from the business side or the clinical side. That's just invaluable. So it sounds like those associations are a great way just to find your people and find your tribe.
Yep, absolutely.
In terms of being in the field, you've been in the field for a couple decades now. Can you give us any information about any changes that you see? Like, have you seen the field evolve at all? Have you seen just anything move forward, maybe progress, or anything go backwards even?
That's a really interesting question. And I would say that I have seen schools that have a lot more females. When I went to school, we had a handful of females that were in my class. And now, I've seen statistics that undergraduate schools are graduating about 58% female, and that's going to translate into more females at chiropractic schools as well. Currently, there are some schools with over 50% female enrollment. That is significantly different than when I was in school, 20 years ago. So that means that ultimately the profession as a whole has to be prepared to welcome this new group of chiropractors who are looking for something a little different. They want to be able to have this professional life and help people, but they also want to really establish a reasonable work-home life balance that will involve having a family and all the nuances that come with that, right? They want to be able to breastfeed at work. They want to be able to get off and, take time to go see a ballet, lesson or a game or an event that their child is participating in. So, and then recognizing that there's going to be days when they're going to be out sick. And I think that in the past has not always been a conducive environment for people who do want that work-home life balance. We have to create this environment that allows these females to thrive and survive in as well. And then we also need to be able to create these avenues or these pathways to help those females that do choose to leave the profession for a period of time and help raise their family, find a path back into achieving active practice, because that's a reality as well. We don't want to, lose these females forever because they don't have a good pathway back into the profession as well. So I think that there is a unique opportunity here for us to be able to provide that for our doctors coming out. And then I also have seen a steady movement of more females involved in chiropractic leadership positions. There was a study reported in the Journal of Canadian Chiropractic Association, which looked at the gender in leadership positions within chiropractic institutions, the regulatory bodies, and professional associations across US and Canada. And they discovered that about 30% were female, and that's awesome. But there is still a huge opportunity here to have more females in those leadership roles. And I think we're going to see that. I was very fortunate as, Chiro Congress president that I was part of a cohort of the first ever all female leaders in the national associations, which again, it was fantastic to be able to collaborate with those women and have really great dialogue. And I feel like we were able to work together collaboratively and find those avenues and those pathways where we found the similarities that we all agreed on. So I would say that is something that I've seen, again, change as well. The last thing that I would probably say in relationship to this question would be that I have seen a lot more chiropractors start to gravitate towards these subspecialties, functional nutrition and pediatrics and sports, which is absolutely amazing to be able to have that specialty. Because as a practitioner, I know I get doctors who refer to me for the pediatrics and the pregnancy, especially those really tough cases. And I do the same to other people. If there's something that I don't exactly have all the expertise in, I work collaboratively with those other providers who do have those expertise. And I feel that it really provides patients with the best opportunity to get the best healthcare that they can get.
Awesome. And of course, that's all of our goal, to help our patients and help get those improvements. And I know a lot of people have that frustration with just the current medical system, everything being in silos and just being shuttled from one specialist to the next. So in the cases of pediatrics and prenatal care, I'm sure that your patients are thankful when you're their guiding light, whether you're answering their questions or you have one other person that you're working with just to help manage their health, their case, and get them the care that they need and not be waiting around for the next appointment that could be months away.
Yep.
With the patients that you're seeing now, I know that you said you have your Diplomate in Pediatric Care. Are you normally seeing just pediatric patients, or can you give us a little bit more of a glimpse into your day-to-day and the types of patients that you treat?
I would say that mostly I'm treating females and kids. That's the majority of my patients. That's what gravitates into my office. So pregnant women, infants, kids. I don't have a lot of patients over the age of 50. Typically, those patients who are over 50 are the people who've just frankly gotten old with me, which is great. But I typically don't attract that. I love my office being a place of excitement and laughter and fun. And not that my older patients don't bring that, they just bring a different type of energy, which is great. I've always said that, again, I love my older patients, but I think I would end up talking to them forever. And that doesn't translate into serving as many people as possible. So I like the kids. I like the younger ones. I had just to give you an example, I had a little boy in my office who I was adjusting his mom, and he looks up at me and he says, "Dr. Holland, I really love circle meat." And so I'm like, okay. I'm like, tell me why you like circle meat so much, because he was really excited about this circle meat. And I had no clue what he was talking about initially. And then he said to me, he said, "Dr. Holland, I love to put ketchup and cheese, and I can put bread around it, and I can carry it places, and I absolutely love it." So I'm adjusting his mom, right? And so she's shaking with laughter. And so I finally understood that he was talking about hamburgers. And so he said to me, he said, "Dr. Holland, do you like circle meat?" And I said, "Yes, I love circle meat, but I love my circle meat with sauerkraut." And he looks at me in complete disgust and he just walks away from me. But like those are the kind of days and those are the kind of experiences that for me, that's what's in my office. And that's what I love. And that's why I love going to work every single day. Again, not that I don't love some of the other, people that I treat as well, but that is a complete joy in my office for sure.
That's amazing. And I love that those little moments and those conversations can actually translate then into nutrition and education in a very small way, but it plants the seed of, oh, why did Dr. Holland say that, Mom? Tell me about what is sauerkraut? Should I try it? What are the benefits? And the mom bringing it up and just trying to teach the kids. So that's amazing. It definitely creates an exciting energy, maybe some chaos as well. Being a mom of a 1-year-old, I could see that there could be a little chaos, but that's always fun. And I think it keeps it interesting, like you said.
I welcome controlled chaos.
Yes, absolutely. And I'm so curious, with pediatrics, are the kids that are coming in, is it a lot of the parents wanting them to get seen, them to get adjusted? Are the kids coming in with complaints? I'm always just so curious just to know kind of the breakdown of that, if the kids are suffering from sports injuries or tightness or nutritional challenges, and what's kid guided versus just the parent guiding that patient encounter.
Yeah, to answer your question, it's going to be mixed. One of the things that I always talk about in my office is it's a lot easier to help grow healthy kids than fix broke adults. I mean, that is my mantra in the office. And so I really try to nurture that in the office. But with that, you have to kind of be prepared for families to come into your office with every single kind of condition and ailment, rashes and injuries, sports injuries, as you mentioned. And I think that with creating that type of an environment where you want to talk about growing healthy kids versus fixing broke adults, that you don't always have the answers. Again, developing that tribe is really important, but creating an environment where patients feel comfortable coming into the office and knowing that I perhaps don't have all the answers, but that I'll find them is really important, and help them figure out where they should go. Is it the urgent care? Is it down to Children's Hospital? Is it to a dermatologist? Where is that? And so I'll get things like that, but I'll also get those parents who come in, with the injuries, and I'll get parents who come in with, like, I've got a bunch of patients in my office who are 8-year-olds who have BMIs of 34 and above, or I have quite a few patients that are under 16 and over 300 pounds. So, having conversations about health in that regard is really important as well. I think the latest CDC statistic I saw was that 21% of our kids under 18 are obese. and 40% of our adults are obese. That's crazy. So, having these good conversations with parents about why our kids are sick and unhealthy, it's because of the bad choices and the bad choices that we're passing on to our kids. So we talk about nutrition, we talk about these concerns, and a lot of times we have to start with the parents, right? Because I'll have parents who come in and say to me, well, my kid won't eat anything but sweets and processed food. Well, what are you eating? What is your diet like? It's not okay if you even have one parent who is on board with change, but you have another parent who has a complete cupboard filled with processed foods and these really bad eating habits. So helping the parent recognize that a child's diet is a learned behavior and they more than likely learned it from their family. So the other thing is helping, parents understand not only with themselves, but with kids, that eating is an emotional experience. And it shouldn't be, but a lot of times it is. When parents have a stressful day, stressful parents don't reach for an apple, right? They reach for the ice cream. They reach for the bags of chips. And so how we teach kids how to handle the situations in life really help them understand how food relates to them as a whole. And I think, again, making these dietary changes is really important. And, talking about water, talking about adding a vegetable, I would say those are the things that are driving, patients into my office. And then of course the sports injuries, the back pain. I mean, that's a whole nother topic. Kids are well beyond, we talk about some lifestyle modifications. So many kids have been playing sports since they were 3, and they're one sport athletes at 12 years old. And this is really creating a ton of sports injuries, elbows, wrists, low back, knees, that is so hard for parents to understand that these kids cannot be these one sport athletes. There's so many multiple folds to what drives people into the office, Sarah, that I could talk all day on it.
Did a great job explaining, and it's so interesting how just looking at the issue of kids' nutrition can be just so tied to emotions and parents' habits. And just going upstream to figure out, well, like, what is the cause? Why are these kids dealing with these issues at such a young age when, like you said, a lot of times they don't have as much even control about maybe the foods that are in their house or what they're being served at school or any of those choices. And it's kind of what they learned. And so having it be on the parents is really interesting because then you're almost seeing the kids as a patient, but having to coach the parents, even if they might not even be your patient. So it's a tough job, but one that you're excelling at and really, like you said, changing the health of the world by changing kids' health. So I applaud you for that. I think that's so important.
Thank you. Yeah, it's like I said, it's a lot easier to help grow healthy kids and fix broke adults.
Yes, I absolutely love that mantra. I think that's something that everyone should adopt and make sure that they're thinking about that in their office and taking it seriously. So thanks for sharing all of that. And I want to go back to what you said about the one sport athlete, because I think that's so interesting. And just a lot of people might not even realize that, especially in areas where people are so focused on helping their kids be elite athletes and high achievers. What do you typically recommend if someone is coming in and right now they're only focusing on one sport, they're doing that all year round? Is there something that you would tell the parents, hey, maybe we should shift to this type of schedule or try these different options, or should they be also on a prehab program, or what do you like to do in terms of kind of getting them on a better track there?
I think the first thing is talking about some nutrition, right? I think that's going to be, a foundation. A lot of kids, when they do exercise, they're not fueling their body efficiently or effectively after they exercise. So I think having a conversation with parents about that, and it can be things foundational like D and proper omegas and, keeping their immune system up, some probiotics, some good zinc. And again, you can supplement with that. And we talk about that in the office, right? You can supplement with that, or you can eat good foods. And so we'll have that conversation. And then after that, it's about making sure that if the parent says to me, no, my kid has to only do this and they're training for this because they are going to be in the NFL one day. Okay, great. So then that means that they're not just going to go to the gym and pump iron and just hilly-nilly, just do random things. They've got to create and be in an environment where they have a coach that's actually teaching them the appropriate ways to pump iron and weight lift and exercise. There is so much nuance that comes with that. It can't just be your teacher who's substituting as a coach, on the weekends. That can't be it. And you can't be in the gym with your peers because it's all going to be a competition. So making sure that if I have those parents that are just all they're going to be is one sport athletes with their kids, then they've got to train the right way. So then we talk about facilities and programs that they can get into to talk about better biomechanics. But if a parent is more at ease with implementing other things, then I always recommend the stretching and the yoga. There's always a really nice opportunity for kids that age to start stretching and start doing yoga, which again, I think is really important. Of course, getting adjusted, making sure the kid's well adjusted. I mean, that goes without saying. And making sure that we are fine tuning the machine, because we've only been given one vehicle to travel this earth in. And so making sure that we are keeping that vehicle tuned up as much as possible is really important. So it's kind of a multi-prong approach with these parents because they've invested a lot of time and energy and finances into making their children these top echelon athletes that unfortunately, again, I've seen time and time again are just not, they're not going on to the NFL. I have had quite a few Division I athletes in my office. They have recognized that they have to train differently and rehab their bodies differently, and they value chiropractic care. So again, multi-prong approach, Sarah.
We'd like to take a quick moment to mention our sponsor, Standard Process. Standard Process is a family-owned and practitioner-focused company that makes high-quality, whole food-based supplements. Many of the ingredients used in the company's whole food-based supplements are grown on-site on their 850-acre certified organic farm. The research and development teams at their Nutrition Innovation Center inform the Standard Process farm team about the best crops to grow and organic farming insights that they share with colleagues and community to help advance organic agriculture as a whole. Clinical insights from their Nutrition Innovation Center have also allowed them to optimize drying times, extract types, and ingredient processing techniques that can contribute to health benefits. State-of-the-art technology also helps to better understand the levels of nutrient density in their crops and determine the ideal strains for ingredients based on their abilities to support unique health needs. To learn more about Standard Process, visit standardprocess.com/only@SP.
Yes, absolutely. And getting started early and getting that preventative care going before things happen. But I think just being that voice is so important for parents, and also almost like the centerpiece again of like that health centered approach, and making sure that they're then getting the specialization that they need, whether it's the training or extra nutrition guidance, whatever that is. But I think it's important to be that voice. So when we're talking about supporting nutrition, I know you mentioned even getting started like with infants, for example. So that healthy nutrition really starts so early. And something that I was surprised about actually when I took my little one in to, I think one of the 3-month maybe appointments, was the pediatrician offering vitamin D, which took me by surprise, right? I think that that's something that I thought that I would be interested in, but I thought that that was great, kind of in conventional medicine, that was already being finally put into practice. I'm sure it's been in the literature for a while, but that was really wonderful. And you mentioned D3 as well. Are there other things that you recommend to parents of really young babies, infants, that these parents are probably coming in overwhelmed, they're tired, they have a lot going on. It can be hard just to kind of wrap their heads around nutrition and a new baby, but are there simple things that you kind of give them as like a nutrition starter pack to kind of help with getting their baby on the right track? Or what would you recommend kind of in those early days or early stages?
Yeah, usually my pregnant moms who come into the office, we definitely are talking about this stuff ahead of time, right? So D3, again, is really important. Finally, as you mentioned, even the American Association of Pediatrics recommends this. And so it is something that is a foundational component to all of my conversations with every single one of my patients, including those infants. And then typically we also start recommending, right away some good fats, right? So having some sort of omegas that the infant can take is also really important. So, and that again, that translates even into older children as well. So good fats, things like avocado. Avocado is the best first food that an infant can have. Again, fish oils are great, so we talk about that, especially again for those little ones, those infants. And then once, the kids get a little bit older and, well, I guess breast milk, I could back up, and breast milk is the best first food possible, right? I mean, I always recommend that my patients, breastfeed for as long as they possibly can. And the other thing that we talk about, especially moms who go back to work and pumping, something that is foundational that moms have to do is that they have to focus on pumping. A lot of moms, and I hear this story all the time, a lot of moms will pump and they'll keep working. And you can't. You've got to go into an environment where it goes back to the cows, and producing milk. You have to go back to an environment that's solely focused on your health and your well-being, which means that you have to focus on baby. And so I always recommend that moms, look at pictures of baby and that they bring with them one of the baby's blankets so that they have that smell, that environment as well, and that they're focusing on baby. They're not scrolling online. They're not looking at Facebook. They're literally thinking about baby. There's been studies out there, and I've heard anecdotally even where there's better milk fat content, with moms who focus on that. They're not focusing on anything else. They're focusing on baby. So I think that's really important. And then for those of my moms who can't breastfeed, making sure that you've got a good formula that is quality formula. I find a lot of our organic European Union formulas, the derived from Europe, actually have some really good things in them. But the key is that we're looking for formulas that don't, contain a lot of fillers or a lot of corn syrup, just a lot of things you can't pronounce is usually how I describe it to parents. So I think that's always really good. And then, also the other thing is that we're not introducing food too early. I think that's the other thing that we have a lot of going on right now. And so my recommendations to parents is wait till your kids start, cutting teeth. At that point, we know that the gut and the stomach is ready for more solid foods. And then once, there's that mouth, brain, gut connection that goes on there. And so once we recognize that, they're breaking teeth, we introduce these solid foods in puree format, but we're starting with foods that are healthy for them, meaning that we're pureeing some, grass-fed dark meat. And that could be dark meat from a chicken or a turkey or red meat as well, but it's pureed, adding some breast milk to it. And then gravitating towards those spinach and the broccoli, things that, we might not associate always providing kids, because a lot of times parents just want to go to the sweets, the sweet potatoes and the bananas and that kind of stuff. If we can postpone those things as long as possible, we're creating the child's palate to accept these really well-rounded foods that can be really important for, again, overall health and well-being. So I think those are some of the little, tidbits that I give parents. And I would say the last one that I probably run into a lot with new parents especially is establishing boundaries for those grandparents. Grandparents absolutely undermine those parents who are trying to provide really good health to their kids, not because they're doing it on purpose, but because that's not how they were, I don't want to say trained, but that's not how they were raised, and that's not how they raised their children. And so, but I have parents who come in and just sobbing because their parents, the kids' grandparents, are just not providing the foods that they want. So it's really taking a hard line and a good conversation with the parents that when they're taking care of the grandkids, that you're providing those children the food that they actually need. But that also means that parents have to prepare those meals ahead of time as well, which again takes planning as well. So, which we also talk about.
Talk about a lot with the patients. That's awesome. They're getting the food info, the parenting info, help with the in-laws and everything. So all that plays a role in it. And I know when we had talked before, you mentioned even food looking appealing, which I think is so interesting, and like this tough line of how can we make foods that are mashed up meats look a little bit more appealing? I don't know if you have any tidbits of insight for that. And it could even be just making the foods more fun for the little ones or something like that. But any things that you have found work well for that, just for getting kids to be eating these healthier items that might be mashed up. They might not be looking cute, looking cute like a nice muffin or something like that.
Yeah, parents have to, work around all the TV commercials and the middle of the aisles of the grocery store that have cartoons and pretty characters that are right on eye level with little ones. So, it can be really challenging. I think preparing ahead of time is something that is so important. I know, having, Pyrex and mason jars and thermoses, that are appealing to kids, and having little spoons that are appealing to kids, is straws, things like that can also be appealing visually, but also having fun foods, making sure you've got brightly colored, green peppers and red peppers and broccoli. And sometimes it also means that you're thinking of creative ways to present it to a child. Ants on a log, that's the kind of tried and true, where, the peanut butter on celery with a little bit of, raisins on it. Or, you could also do hummus on a pepper spear, with little pecans on it, that can be very helpful. Or, spreading out some hummus in a Pyrex and throwing some cherry tomatoes on there, and you've got, balls in a pool. So things like that. And you could draw little designs with, spears of green peppers. And, so there's things I've got a lot of parents who actually do cutouts of various things with cookie cutters. So to just make it a little bit different and decorating food that way. So there's definitely some appealing ways. Once your kids get a little older, now you can shop with them. I've got I have a lot of stay-at-home moms who also homeschool their kids in my office. And so one of the things that they'll do is they'll have their child do a project on how, green peppers are made and kind of what's the process of it. And so they do a whole kind of unit on how good vegetables and fruits are made and grown. And so having kids involved with the shopping and the understanding and the preparation is also really good and a good way to establish some good health care and health options. The other thing I tell parents is that this is about 80-20, and it's really, really hard to eat healthy. So 80-20 is okay. And when you start to get your kids who are 12, 13, 14, they're going to experiment with bad food. And to understand that and knowing that it's okay, that they're going to eventually come back to the light. They're going to eventually recognize how their body feels when they eat these really bad foods. One of the unique opportunities in my office is that I see these kids as infants, and then all of a sudden they're driving into my office by themselves. And it's like just this whole, interesting experience. But they'll tell me, Dr. Holland, I tried McDonald's, I tried this stuff, and I really felt awful afterwards. So they associate it with it, they recognize it. They'll eventually start eating better again, but they're going to experiment and not having frustrated parents that they're thinking that they're never going to eat healthy again. I think it's also really important for those parents to recognize that they're going to come back. They're going to eat healthy again. It just might take them a little bit longer as well. So
those are great insights. I'm sure all the moms listening or soon to be moms are rejoicing at those ideas, because I know sometimes it can be tough to be creative and think of new ways to get the kids to eat healthy, but those are all great ideas. So thanks for sharing those. And I want to kind of switch topics a little bit just to see more about your other patient population, which is that prenatal section of patients. And so when people are coming in for either prenatal care or even maybe they're working on conception and improving their fertility, is that something that you help with? I'm just curious with the nutritional tie to fertility. I know that's been talked about a little bit more recently, a little bit more in the media, but is that something where people are asking you for help in that? Or is it mostly just prenatal support just for musculoskeletal issues that you're seeing come in?
I would say it depends on how long the patient has been with me if they feel comfortable approaching those issues. I don't necessarily have a huge population that's coming in and saying, chiropractic and pregnancy and infertility issues. So I wouldn't say that I'm seeing a ton of that. I know that there's chiropractors who specialize in that kind of functional nutrition component of it. But at a foundational level, I always do talk to my younger patients, the childbearing year patients, about, getting pregnant and things to kind of think about. And one of the things that we do think about and we talk about is that the male health as well. About 30 to 50% of infertility issues for couples are also driven by males. I know I've had a lot of women in my office who will say to me, it's only my fault. It's we can't get pregnant because of me. And that's not always the case. It takes two to tango, right? And what I found is that folate deficiency in men is actually a really big issue. So, and a systematic review done in 2021 showed evidence associated between folate status and sperm quality, as well as fertility issues, congenital malformations, and placental weight. So all those things are huge when it comes to males and being deficient. And the other thing that I'm seeing with men, especially besides just folate, is also CoQ10 and selenium are also things that have been demonstrated in research to improve the sperm concentration, as well as motility and antioxidant status in these infertile men. So, it's not just going to be about, the female health, which again is important, making sure that we have a good understanding of what the diet and the nutrition status is of a female, but also thinking about what is the partner, what is that sperm, and how healthy is the sperm as well. So that's something that I talk about with women, because that's usually where I start. And then, the males come in and then we start talking about that as well. So, and I would say that other areas and other things that I see in women coming in is back pain. So I do see the musculoskeletal conditions. I think there's estimates out there, somewhere between 45 and 50% of females experience low back pain, in their pregnancies. And sometimes I've seen research as high as 90%. So we also see that there is that avenue of patients coming into the office. And the other factor that I just want to touch on is that we see that over 65% of women will experience some sort of low back pain within 12 months of delivery. And that's one of the areas that I feel as a society, we don't talk enough about, is that fourth trimester care for women. We talk about beforehand and when we talk about the males and the females, but we forget about women after they've delivered because everything now goes to the focus on baby. So we have to start really focusing. And that's something in my career that I have really noticed is that as my patients have gotten old with me, my women that I had in their early 30s are now in their 40s and laughing and peeing at the same time. And so making sure that we establish a really good foundational understanding of biomechanics and nutrition and stress management, exercise and posture, even before they get pregnant, so that while they're pregnant and then into that fourth trimester, that we've really established a very good foundation of posture and nutrition and biomechanics, because I don't want my women to laugh and pee at the same time or have jump rope and then peeing. Those are the conversations that unfortunately just do not happen a lot. And I've been really focusing on the last half of my career here, I've been really focusing hard on making sure that we can prevent that stuff before they even get pregnant and then really work on it afterwards.
That is so important. I think I really resonate with that 65% of low back pain within the 12 months of delivery. Just on a personal note, during my pregnancy, I was getting adjusted routinely, and I just made that a priority to make sure I was getting in to my chiropractor and just staying on top of it. But then, of course, what happens? You have your baby. Everything's busy. Your care can sometimes go out the window. And so lo and behold, had that SI pain after. And so that is something that is just so important to keep on your calendar, make sure you're prioritizing yourself as well. And as healthcare providers, maybe putting those appointments on the books and just saying, you know what, we got to make sure that you're having your check-ins and your checkups and staying on top of it. I saw a really disheartening statistic actually from the American College of Obstetricians and Gynecologists that only 40% of women attend their postpartum checkup. So that statistic is just tough. It's tough to swallow. And the more that, like you said, you can focus on the fourth trimester, that is so crucial. It's so important. And if you're creating that space for women to come in with their kids and their babies, that's just, I think, even better because they feel welcome. They feel like it's a warm place. They're comfortable bringing their kids. They're comfortable breastfeeding. And so the more practitioners that we can have that are taking that stance, I think that's really helpful for all the moms and new moms to come to have a place that they feel comfortable.
And I think, Sarah, I think you hit the kind of the nail on the head. I always tell my moms, even before they get pregnant, my office is a place where if you are out and about, I don't want you breastfeeding in your car. Come into my office. I will always create space for you. There's always a spot here. Do not sit in a cold car and breastfeed your child. Come into my office. There's so many things that we don't think about with that fourth trimester. And it gets worse the more children that women have. It's always focusing on the kids. I can't tell you how many times per week I tell a mom, the family does not function without you. And you have to make yourself a priority. I know it's really hard, but you have to make yourself a priority because you need to be there for your family. So I think, Sarah, you hit the nail on the head. So
I think you said it really well. And that's just a beautiful thing, telling moms that they can come into your office, pop in, maybe even if they don't have an appointment, just so they are getting taken care of. I think that that's wonderful and speaks to the culture that you've created at your clinic and also just the culture that you're bringing to chiropractic. And that is just a beautiful thing. I got teary. I got goosebumps, I have to say. Mm-hmm. So thank you for being that way. I think it's really important. Mm-hmm. And I think another thing that really just differentiates chiropractic that is just branching off from that is really just being patient-centered. I think everything that you've talked about with the space that you create, all the ways that you help your patients, it's just kind of touching all areas of their life to improve their own health experience, but just helping them show up better in their lives as a whole. I know before you mentioned that chiros are just really all about patient-centered healthcare. I think that, not trying to put other practitioners down or anything like that, but I know a lot of people may feel like they're rushed in other appointments. Maybe they feel like they're not seen, they're not asked how they're doing or feeling. And so are there any aspects that you think just of your patient encounter that really help the patient feel like it's patient-centered, or what do you feel like you kind of do, or that advice that you could give to another practitioner just to help foster that just patient-centered care value?
Yeah, and I think chiropractors, we even go above and beyond just patient-centered. I think we have moved into a person-centered model. Something where, we are concerned about the person themselves, the person who is in front of us. And I think one thing that chiropractors do a really good job on is we figure out the loss. People come into the office because of pain, but they really come into the office because of what they've lost because of the pain. They can't get down on the floor and play with their kids. They can't, go play golf. They can't, get up from a chair. It's that loss. So I think chiropractors do a really, really good job of figuring out what that loss is with the patient and then working with the patient to figure out how you achieve that again. So I think that's one of the foundational components. And I think the other thing is that we are good listeners. We are hearing what the patient is telling us, and we're listening to it, and then we're making recommendations and plans based off of that. I think we do that. Again, I have a primary care provider that I see. As Sarah, as you know, I've had knee surgery recently. We chiropractors are above and beyond the patient-centered. We are a person-centered group of individuals who really focuses on why the person's in the office and really listening to what the patient needs to achieve their health, according to them.
Yeah, wonderful. I couldn't agree more. And I think that it's just great that you've set up your office in that way. And hopefully everyone listening, and especially all of the new doctors coming out, can really take that to heart and know that that is so important. It's important for your current patients. It's important for them to feel that so that they share that with other people and improve your referrals. It's going to have a ripple effect in terms of everything that you're doing, all the good. So thank you for sharing that. And I guess with our last few minutes here, I think that something that we touched on, especially with kids, is just a lot of kids are not nutritionally well. They're dealing with being overweight. I'm sure a fair amount of adult patients that you see deal with the same thing. I know a lot of people in our culture right now, they are sedentary. They don't have good nutrition. They're very busy. They get fast food, and they might be overwhelmed with changing and feel like, oh, I can't change, and they're stuck in their habits. And I would love to just know what you might tell someone if they're overwhelmed, they don't really know where to start. Are there any just 3 to 5 simple changes that you feel like, hey, if you really just worked on making these few changes, this could move the needle for you, at least get the ball rolling, give them some of that maybe good momentum just to get them back on their health journey?
Yeah, I think that how I approach it in my office is that I don't take things away from patients. I try to recommend adding something to their diet, because patients kind of bristle. People in general kind of bristle when you say, I want to take this out of your diet, something that has been a part of your life forever. And sometimes is an emotional crutch as well, right? So adding something in, let's start with water. Let's start with, if you drink soda all the time, let's start with having a glass of water for every can of soda or bottle of soda that you're consuming. And so that's usually where I start. And of course, I've already talked about D3. I'm a big fan of D3, adding D3 to everything. And then I think the next thing is that recognizing that you should never sit down with a bag or a box, making sure that you moderate your portions and weigh or pre-measure your portion size. I think that is, that's a manageable step for patients. At the very least, do not sit down with a bag or a box. And then I think that, the other thing is trying to eat some vegetables. And typically I recommend having vegetables before you consume anything else. So having my rule's 5, so have 5 of something, some vegetable, a broccoli, a cauliflower, whatever you like, carrots, spice it up, have some cherry tomato, whatever it is, but eat 5 and do that before you eat anything else. I'm not saying not eat, the nonsense you want to eat, but just at least have those 5 vegetables. The other thing is stop eating when you're 80% full, and then stop eating when you stop tasting it. Those are my 2 things. If you've ever noticed with food, especially the processed food, is that there comes a point in time when you stop actually tasting the food. So recognizing where that spot is, stopping eating it, and giving yourself permission to go back if you really, really want it. Like ice cream would be an example. If you've got the bowl or you've got the bucket in front of you, and you take, 5 scoops of the ice cream, and you're like, okay, I stopped tasting the ice cream, stop eating it, put it away. And then if you really, really desire it again, go back to it. But again, do the same mentality. Stop eating it when you stop tasting it. I find that, again, by doing those little things, 80% full, stop eating when you taste it, don't sit down with a bag or a box. Those little things are manageable to patients. And when you create a manageable experience, you create a patient who is more willing to do other things like exercising and stretching.
Absolutely. Awesome. I love those. And I think a lot of people deal with that overwhelm of just saying, oh no, like what's the best diet? People are saying all these things are bad. Gluten's bad, dairy's bad. What am I going to eat? And so I love the approach of kind of flipping that on its head and just saying, how about we're adding the good things in, starting there. They'll end up hopefully feeling better and kind of getting that foot in the door there. So that's perfect. And I guess just to finish up, is there anything that you just specifically love about your job, your favorite part of your job that you'd like to share, and just end on that positive note? Not that this conversation hasn't been really positive, but I just love hearing if there's a favorite part of what you do or something that you're just most passionate about that you want to share with the listeners.
Well, I'll start off by the favorite part of my job is notes. I would say that's probably the least favorite part of my job. And I think every practitioner is probably out there going, yeah, absolutely. But I would say the best part of my job is my patients. I absolutely have the best patients out there. Again, I've had doctors filling in my office, and that's one thing that they'll tell me repeatedly. You've just got some of the best patients. And I think that's because I really work hard on achieving an office that is a wonderful place to be at, not only for the parents, but for me. And, one of my goals in treating my families and being in practice for over 20 years now and see my little patients grow up, I would say that for me, my best day in practice is going to be, and I'm getting close, is going to be when one of my infants that I've seen since they were infants or in utero, bring in one of their kids to see me for their very first adjustment, their child. That for me is going to be the best day, and hopefully many really wonderful days like that in the future. And so again, I would have never been able to achieve any of that without having just awesome patients.
That's amazing. It makes everything worth it. It makes all the notes worth it, all the hard days. And that must just give you such great joy and peace. So thank you for sharing that. Yeah. And I know a lot of practitioners can understand that feeling, and it's why we do what we do. So it makes sense. Wonderful. Great. Well, thank you so much, Dr. Holland, for being with us today. Really appreciate your time and wisdom and all the expertise you shared.
Great. Thank you, Sarah.
Thank you.
Tune in every first and third Thursday for new Holistic Matters episodes, and be sure to like and subscribe to our podcast on your favorite platform. Remember to visit holisticmatters.com for a wide range of holistic health content to keep you up to date on the latest nutrition science and herbal health trends. We hope you enjoyed today's episode. And a special thank you to our sponsor, Standard Process. Thank you for listening. Visit holisticmatters.com for more content. And remember, that's holistic with a W.